Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Scarborough from Scarborough Family Medicine. And guess what, everyone? It's February and it's all about Heart Health Month. Welcome to the show, my friend. How are you?
I'm good.
Tell us a little bit about heart health here in America and where we stand in the state of Georgia compared to other states of America. And is heart health different for men and women? 3 questions in one.
Yes, you've loaded me up.
Yeah.
So heart disease is the number one reason for mortality, morbidity, big words for meaning that,
Really?
it costs a lot of healthcare dollars and it's very prevalent. It's the number one reason for deaths in America.
I did not know. I thought cancer was.
It's not. It's
It's
for
heart
men
health.
and women, it's heart disease.
Look, let's be real. Has a lot of it got to do with obesity
It does.
and our everyday life?
It does. Obesity and diabetes are very much a part of that statistic.
So what are you suggesting we do about that? Look, and I don't want to say the obvious, going on a diet,
Right.
okay? Because
We all know that.
we all know that. And
But it's so difficult.
it's difficult, it's hard to maintain, especially if you are in the obese category. But let me tell you, I was just saying to some people at lunch today, there was a moment a few months ago that I was at 238 pounds and my doctor said to me I was obese.
Yes.
I didn't feel or look obese, right?
Well, that's because we compare ourselves to one another. 1 in 6 people in America are obese. And so that, we're looking at other people and so we're comparing ourselves to other people that, struggle with weight loss.
Yeah.
And
Well, you see these shows on TV, My 600-Pound Life, and you look at that as being obese.
Right.
Right? You don't look at 238 pounds as being obese.
Exactly.
So let's talk about some of the symptoms that I may have heart issues.
Okay.
What would they be if someone's sitting at home watching us now? Explain to them what they might be experiencing.
Okay. Well, the obvious is chest pain.
Right.
And left arm pain. Those are the typical symptoms that we see in men, but the atypical symptoms, which we see in diabetics and women, are a little bit different. So people that have heartburn early in the morning, between the hours of 3 and 10, that may be a telltale sign that that may be a heart symptom. Shortness of breath. All of a sudden, I'm not able to walk up those flight of stairs without, really getting short of breath. And so that might be a telltale sign that, hey, there may be something going on with your heart.
Yeah.
So
I'm going to say I had that problem. And then I went to the doctor and they said my cholesterol was skyrocket high.
wow.
I had no idea. I thought I was healthy. What are some things that people can do at home to help them get back on track?
Well, it is very difficult, like you said, to do the diet and exercise, but we talk about getting a buddy to help us stay active. Social gatherings in the South, we typically, we're eating around the table, we're going out to eat.
Yeah.
Maybe we need to switch that up. Maybe, hey, let's grab a friend, let's go for a hike, let's take up new hobbies like bike riding, going to the gym. Those are all great things. Trying to find activities that are away from, an eating activity. I think that's very important. Maybe not eating out as much, maybe limiting that to the weekend.
I want to ask you a question. For someone sitting at home and they want to call you to come in for a checkup for this type of thing,
Right.
but they're a little bit embarrassed because they know they're a little overweight and they just don't know what to say.
Yeah.
What do they say? What are you going to say to them?
They can call us up and say, hey, I'd like to get my heart checked out, or, I just want a regular checkup. And we can discuss all that in the office. We talk about this every day. We all struggle. We all struggle with
Yes,
the
we
eating
do.
out and trying to stay on track with exercise. We're all on that bus together.
Listen, it kicked my backside when my doctor told me that, and it freaked me out. So I was back at the gym and
good.
having to change your lifestyle. I hear what you mean.
Yes, you have
Dr.
to
Scarborough,
change.
thank you so much. We appreciate
Thank you.
it. If you want to find out more information about Scarborough Family Medicine, there it all is up on the screen. Incredible team over there. They'll take care of everything you need to know. And remember, February is Heart Health Month. Protect your heart and have a good life.